And now we present you the press conference conducted by Nathapanu Nopakun, the Deputy Spokesperson for the Ministry of Foreign Affairs at a meeting of the Center for COVID-19 Situation Administration.
Good afternoon. Today is Wednesday, the 22nd of September 2021, and this is the English language summary of the press briefing for today. This is Nathapanu Nopakun. I'm Deputy Spokesperson of the Ministry of Foreign Affairs. So we had today in the Thai version Dr. Chawet-san from the CDC, or Center for Disease Control, Department of Disease Control of the Health Ministry, giving us some updates and recaps. He mentioned about Thailand being globally number 29 now. Also in terms of infection ratio, as per 1 million persons, Thailand has now an infection ratio of around 21,000 per 1 million. Now that comparatively to other countries like the United States or India is quite low, wherein those countries have around 129,000 and 109,000 respectively per 1 million population. In Thailand there had been some quite a general decline, just in the same way that there is a general global decline in terms of the infection. Now, one good news is that the cases of lung infection in Thailand, as well as the patients with ventilators, had declined substantially. For patients, serious patients of COVID using ventilators, the number within the month of September had decreased from 1,040 to around 750 already. Now, for the vaccination progress, yesterday we administered quite a high number of vaccines. To be exact, it's 811,915. So over 800,000 doses of vaccine was administered yesterday. Now that makes the total number cumulative now at over 46 million in Thailand. Of that number, 811,000 doses yesterday, we have around 511,000 who had already received their second jab, and the number of people who have received their first jabs is over 300,000, and that was for yesterday only. So the number of people receiving the second dose is now greater than those who have received the first dose. This means that we're making good progress towards the target of Thailand's vaccination campaign. Now in Bangkok, over 99% of people aged 60 have already received their first dose. And as of now, provinces like Bangkok, Pathum Thani, Chachoengsao, Phang and Ranong have already completed vaccination way above 70% in the age group of those who are 60-year-old and above. And many other provinces are accelerating their inoculation for the elderly. For daily numbers, we have new confirmed case today at 11,252. We have active cases at the moment now at 129,000, over 129,000, of that number, 3,464 are in critical condition, and as I mentioned, 753 are on ventilators. So we have new confirmed case at over 11,000, but we have new recoveries today at over 13,000, so a higher number, 13,695 new recoveries for today. We have new fatalities standing at 141. The fatality rate remains at 1.06%. We have also the issue about the Communicable Disease Act amendment, wherein yesterday, the 21st of September, the Cabinet approved the draft amendment to the 2015 Communicable Disease Act. And this amendment is aimed at enhancing the effectiveness of disease control and accelerating the attempt to contain the serious new outbreak. Now, this amendment will also serve as a new mechanism to replace the emergency decree in the country's battle against COVID. And moving forward, should a serious outbreak erupt, the emergency decree will no longer be needed. Instead, this amended Communicable Disease Act will be invoked. Now, the CCSA, which is established under Section 7 of the emergency decree, will technically no longer exist if the state of emergency isn't renewed, and there will be an official announcement on this matter when all related matters are approved. But in practice, at the moment, the CCSA will continue to function, although it may have to be transformed into a new body after the state of emergency is lifted. Now, for the new Communicable Disease Act, of course, that passed through Cabinet, as mentioned. Now, the authorities will be adjusting the content of the Act, fine-tuning it, and that will take some time. So for it to be fully in effect, it might be taking some time. It might be a little bit after October the 1st. So that was the information that we received from the Thai language briefing just now. Also, there is the issue about the quarter 4 reopening of Thailand, the opening of Thailand in quarter 4, wherein Dr. Chwetsan showed us a timeline, a calendar, particularly on quarter 4, which actually is from October to December. Now, there will be two approaches, which is the island approach, which has begun in quarter 3, and the inland approach, meaning provinces that are inland, which will start in quarter 4. This opening should be by the 1st of November through sealed routes. And in this island approach reopening in quarter 4, it will include Bangkok, most likely in Bangkok as well. But of course, this depends on the evaluation to that date. The quarter 4 reopening in the inland approach, aside from Bangkok, will include other provinces like Phetchaburi with the beach town of Hua Hin. It will also include Chiang Mai. And the theme for that opening would be Charming Chiang Mai. It would possibly include Pattaya, and the theme would be Neo Pattaya. Of course, the considerations are very important before that date in terms of the vaccine percentage and other consideration before this quarter 4 reopening begins. Now, in Pattaya, for example, the Pattaya mayor revealed that for the theme in Pattaya, which is Pattaya Moves On, the sandbox there is on track for opening. The other provinces that I mentioned are also planned for that date. And according to the TAT, the Tourism Authority of Thailand, the 5 provinces mentioned, except for Bangkok, are most likely ready for the opening. While Bangkok, we in Bangkok are aiming for reopening perhaps by the time that the numbers of the infections are lower and the considerations are made to be fully ready. So as you can see in the news, the timing right now is still not firm yet. It depends on the consideration, depends on the various evaluation of each of these provinces. There have been reports about October, but according to the latest information, we should seek the opening of these provinces the latest perhaps by early November. But we'll see according to the situation if this date will actually change or move or not. It's still quite fluid, but we're keeping you informed on a regular basis. Now, lastly, before I end, just like to mention that towards the end of September, there are many gatherings and social gatherings and festivals in Thailand, including religious merit-making festivals like the Kathina or Kathin festival, as well as various festivities for those who are vegetarians, for example, in Thailand. That's a tradition. Also, it's the season wherein it's the retirement season in Thailand as well. So all the social gatherings would have to take precaution because of the COVID situation. So basically, this is what I have for you today. The important point is, of course, about the act, the new act on disease control that will hopefully soon be in effect, and therefore the emergency decree will not be necessary anymore. Whatever measures that come out because of the non-use of the emergency decree will let you know in due course. That will have to be considered, and whatever issue or measures come out from the new Disease Control Act will keep you informed as well. An important point is that in Thailand, just like in around the world, we're seeing a relatively global decline in the numbers, which is good news. So with that note, I wish you all safety and health for the rest of this week, and we'll see you again next time. Thank you very much, and สวัสดีครับ
And that was Natapanu Nopakun, the Deputy Spokesperson for the Ministry of Foreign Affairs, giving us the updates on the COVID-19 situation in Thailand.